If you are over 65 and you have been told your blood pressure is high, you are not alone, not even close. 6 out of every 10 adults over the age of 65 in the United States have high blood pressure. 6 out of 10, that is the majority. That is most of the people in your age group. And yet, despite how common it is, despite how many people are living with it right now, most of them cannot answer a few basic questions about it. Questions like, what do these two numbers actually mean? What is actually happening inside my arteries? Why does it matter so much? And what does monitoring it at home actually tell me? I am Dr. Daniel Chen, and today I want to sit with you and answer those questions honestly, not with alarm, not with complicated medical language, but the way I would explain it to a patient sitting across from me who deserves a real answer, not just a prescription in a pamphlet, because high blood pressure after 65 is not a life sentence. It is a condition that can be understood and managed well when you have the right information. So let us start at the very beginning. Let us talk about what blood pressure actually is, because most people have been hearing those two numbers for decades without ever really knowing what they mean. Your heart beats roughly 60 to 100 times per minute. Every single beat pushes a wave of blood through your arteries out to every organ and tissue in your body. Blood pressure is simply the measurement of the force that blood exerts against the walls of your arteries as it moves through them. Now, there are two numbers in every blood pressure reading. The first number, the one on top, is called systolic pressure. It measures the force inside your arteries at the moment your heart beats, at the moment of maximum pressure. The second number, the one on the bottom, is called diastolic pressure. It measures the force inside your arteries between heartbeats, when the heart is resting and refilling at the moment of minimum pressure. So when your doctor says your blood pressure is 130 over 80, they mean the pressure peaks at 130 millimeters of mercury. When your heart contracts and falls to 80 millimeters of mercury, when your heart is at rest between beats. Now here is what the current guidelines actually say about what these numbers mean for adults over 65. Normal blood pressure is considered below 120 over 80. Elevated blood pressure is 120 to 129 systolic, with a diastolic below 80. Stage 1 high blood pressure, which doctors call hypertension, is 130 to 139 systolic, or 80 to 89 diastolic. Stage 2 high blood pressure is 140 or higher systolic, or 90 or higher diastolic, and a hypertensive crisis, which is a medical emergency requiring immediate attention, say reading above 180 systolic or above 120 diastolic. Now I want to pause here and say something important. These numbers are guidelines, not universal verdicts, because here is something most people do not know. Treatment targets for blood pressure are not the same for every person over 65. They are individualized based on your overall health, your kidney function, your fall risk, your other medical conditions, and the medications you are already taking. A doctor treating a healthy and active 68-year-old will approach blood pressure targets very differently than a doctor treating a frail 88-year-old who is already on multiple medications and has a history of falls. This is why high blood pressure management after 65 is not a simple formula. It is a conversation between you and your doctor about what is right for your specific situation. Now let me explain why high blood pressure becomes so much more common after 65, because understanding why it happens helps you understand why it matters as we age. Several changes happen inside our arteries. The walls of the arteries, which are made partly of smooth muscle and elastic tissue, gradually become stiffer, less elastic, less able to expand and contract smoothly with each heartbeat. This stiffening is called arteriosclerosis, and it is a normal part of aging. It happens in everyone to some degree. When arteries are elastic and flexible, they absorb some of the force of each heartbeat, like a flexible hose that expands slightly to accommodate the surge of water coming through it. But when arteries become stiffer, they can no longer absorb that force as efficiently, so the pressure inside them rises higher with each heartbeat. This is why systolic blood pressure, the top number, tends to rise with age, even in people who are otherwise healthy and take good care of themselves. There is also a second mechanism that becomes increasingly relevant after 65, and that is the kidney. Your kidneys play a central role in regulating blood pressure. They do this partly by controlling how much sodium and therefore how much fluid stays in the body. When the kidneys retain more sodium, more fluid stays in the bloodstream, blood volume increases, and blood pressure rises. As kidney efficiency gradually decreases with age, this sodium regulation becomes less precise, and the tendency toward higher blood pressure increases. This is one of the reasons why sodium intake becomes more relevant to blood pressure management. As we get older, not less relevant, more relevant. Now let me explain why high blood pressure matters so much in a way that goes beyond just the numbers. Your arteries carry blood to every single organ in your body: your heart, your brain, your kidneys, your eyes, your peripheral circulation. When blood pressure is consistently elevated, the force of that pressure acts on the delicate inner lining of those arteries over time. This sustained pressure causes damage to that lining. It triggers inflammation. It accelerates the buildup of plaques inside the arterial walls, plaques that narrow the artery, that reduce blood flow, that can rupture and trigger clots. High blood pressure is the leading risk factor for stroke, for heart attack, for heart failure, for chronic kidney disease, and for a condition called hypertensive retinopathy, which is damage to the blood vessels inside the eye that can affect vision. And here is the thing that makes high blood pressure particularly difficult to manage. In the early stages, it causes no symptoms at all. Most people with elevated blood pressure feel completely normal, which is why it has earned the name the silent killer. You cannot feel your blood pressure rising. You cannot sense the damage it is slowly causing inside your arteries and organs. The only way to know is to measure it regularly, consistently, over time. This is why monitoring matters so much. And this is what I want to spend time on now, because I find that most of my patients know they are supposed to check their blood pressure, but very few understand what good monitoring actually looks like or what to do with the numbers they get. So let me walk you through this properly. The first thing to know is that a single blood pressure reading taken once at a single moment in time tells you very little. Blood pressure is not a fixed number. It fluctuates constantly throughout the day. It is higher in the morning, after waking, lower in the afternoon for most people, higher when you are anxious or in pain, lower when you are relaxed, higher after physical activity, lower after rest. It can be affected by the position you are sitting in, by whether you have recently had caffeine or alcohol, by whether your bladder is full, by whether you are cold, by whether you are in a doctor's office. That last one is important enough that it has its own name. White coat hypertension. This is a well-documented and very common phenomenon where a person's blood pressure reads significantly higher in a medical setting than it does at home, simply because of the anxiety and stress associated with being in a clinical environment. For this reason, home blood pressure monitoring. Using a validated home blood pressure monitor is now considered by most guidelines to provide more accurate and useful information about a person's true average blood pressure than occasional readings taken in a clinic. So what does good home monitoring actually look like? Here are the specific recommendations that I give to my own patients and that are consistent with current clinical guidance. First, take your blood pressure at the same times every day. The most useful times are in the morning, before you have taken any medications, before you have had coffee or tea, and before you have eaten, and in the evening, before dinner. Second, before you take the reading, sit quietly for 5 minutes. Do not talk. Do not check your phone. Just sit still with your feet flat on the floor and your back supported. Do not cross your legs. 5 minutes of quiet sitting before taking the reading is not optional. It genuinely affects the accuracy of what you measure. Third, position the cuff correctly. The cuff should be placed on your upper arm, not your wrist. Wrist monitors are less accurate. And the cuff should be at the level of your heart, approximately at the level of your chest, not held up in the air, and not resting on your lap, at the level of your heart. Fourth, take 2 or 3 readings in a row, 1 minute apart, and record all of them. The first reading is often slightly higher due to the natural alerting response of having the cuff inflate. The average of the second and third readings is usually more representative of your actual pressure. Fifth, keep a simple log. This does not need to be complicated. A small notebook kept next to the monitor with the date, the time, and the readings is all you need. This log becomes genuinely valuable when you bring it to your doctor because it shows your blood pressure over time in your real daily environment. rather than a single number taken in a clinic. Now I want to talk about something that many patients have mentioned to me about home monitoring, and that I think is worth addressing directly. Some people become very anxious about home monitoring. They check their blood pressure multiple times a day and find themselves focused and worried about every slight variation, getting increasingly stressed about a high reading, which then raises their blood pressure further, creating a cycle. If you find that monitoring is adding stress to your daily life rather than information, please mention this to your doctor. There is a balance between useful monitoring and monitoring that causes more harm than good. For most people with stable, well-managed blood pressure, 2 readings per day, taken consistently at the same times and reviewed with a doctor at appointments is appropriate. You do not need to check it every hour. Now let me talk about the lifestyle factors that genuinely have evidence behind them for supporting blood pressure management. These are not guaranteed fixes. They are genuinely evidence-backed strategies that complement whatever treatment approach your doctor recommends. The first is sodium awareness. The relationship between sodium intake and blood pressure is well established in research and becomes more significant with age as kidney efficiency decreases. The American Heart Association recommends aiming for no more than 2,300 milligrams of sodium daily for the general population, and many guidelines suggest aiming for 1,500 milligrams for adults with existing high blood pressure. The most significant sources of dietary sodium are not the salt shaker at the table. That accounts for a relatively small portion. The most significant sources are processed and packaged foods, bread, canned soups, deli meats, cheese, restaurant food, reading food labels, and being aware of the sodium content of the processed foods you regularly buy is where the most meaningful dietary impact comes from. The second is physical activity. Regular aerobic activity, such as walking, swimming, or cycling, is one of the most consistently evidence-supported, non-medication approaches to supporting healthy blood pressure. The general recommendation for older adults is 150 minutes of moderate intensity activity per week. This does not have to be done all at once. 3 10-minute walks per day meets the same target as 1 30-minute walk and is often easier to build into a daily routine. For adults over 65, the third is alcohol. Alcohol raises blood pressure. This relationship is well established in the research and is one that many older adults are not fully aware of. Limiting alcohol is a genuine and meaningful part of blood pressure management for those who drink. The fourth is stress. Chronic psychological stress is associated with higher blood pressure over time, not because stress itself directly damages arteries, but because sustained stress raises cortisol and adrenaline, which raise heart rate and blood pressure, and because stress often leads to behaviors that are themselves bad for blood pressure. Poor sleep, less exercise, more alcohol, managing stress. Through whatever approach works for you, whether that is social connection, time in nature, prayer or meditation, or simply having a daily routine that feels manageable, is a legitimate and recognized part of blood pressure care. Now let me say something about medications, because most adults over 65 with high blood pressure are on medication for it. And many of them take that medication every day without fully understanding why or what it is doing. Blood pressure medications work through several different mechanisms. Some reduce the volume of fluid in the blood. Some relax the blood vessel walls. Your doctor chose your specific medication based on your blood pressure pattern, your kidney function, your heart health, your other conditions, and your other medications. It is not random, and it is not one size fits all. What I would encourage every person over 65 taking blood pressure medication to do is to ask their doctor at their next appointment these 3 questions. First, what is my blood pressure target, and why that specific target for me? Second, what would make you consider adjusting this medication, either increasing it, decreasing it, or changing it? Third, are there any side effects from this medication I should watch for and report to you? These are not complicated questions, but they will give you a much clearer picture of exactly where you are in your blood pressure management and what your doctor is watching for. You deserve that clarity. Let me bring everything together for you now. High blood pressure affects 6 in 10 adults over 65 in the United States. It develops primarily because arteries stiffen with age and because kidney sodium regulation becomes less precise. It causes no symptoms in most people, which is why consistent monitoring is the only way to track it. Good home monitoring means same-time daily readings after 5 minutes of quiet sitting, cuff at heart level, 2 or 3 readings recorded, and a simple log brought to doctor appointments. Lifestyle factors with the real evidence behind them include sodium awareness, regular physical activity, limiting alcohol, and managing chronic stress. And medication, when prescribed, is chosen specifically for each person's individual health picture, not applied as a single formula. The most important thing you can do is stay engaged with your own care. Know your numbers, keep your log, ask your doctor the right questions, and understand that high blood pressure, when monitored and managed well, does not have to define your health or limit your life. I am Dr. Daniel Chen. If this video gave you a clearer picture of something you have been living with, but never fully understood, please share it with someone over 65 who has also been handed a diagnosis without a proper explanation. Subscribe to this channel for weekly videos made with genuine care for older adults who deserve real information about their own health. And leave me a comment below. Tell me what your blood pressure number is that you are working on right now. I read every single comment, and I look forward to hearing from you. Take care of yourself. You deserve to understand your own body